Now that we've discussed that, let's move on to our final topic. And we saved this one for last because it's a big topic. So big that it encompasses 1/6 of the United States economy. And that, of course, is healthcare. So first of all, before we get into any of their plans, why does healthcare encompass 1/6 of the overall U.S. economy?
Well, to answer that is, people on average live to be about 80 years old. It's a little variance in states and a little variance by gender, but you don't get to live to be 80 without a lot of help. Okay, and it may be just some pharmaceuticals. Sometimes it's more major intervention. But let's keep in mind, if you go back to the turn of the century, as in the turn of the 1800s to the 1900s, average life expectancy was only around 40 or so. So it costs money to live longer. So that's why healthcare is such a big component of our economy.
Also, one of the things, and this is a very complicated topic. Most people have health insurance. Now we're concerned, and Biden is definitely concerned about providing more coverage for more people. Most people have coverage through their work. Most of the coverage pays most of the expenses. At Montclair State, we have a variety of different plans available to us that unfortunately I've availed myself of with various orthopedic accidents over the last few years. I didn't pay a nickel out of pocket. I didn't hesitate to seek medical care because I knew it wasn't going to cost me anything. I pay premiums for my paychecks, but the actual going to the doctor didn't cost me anything. Roughly 85% of this country, between 80 and 85%, has healthcare, has some kind of insurance. They're more likely, from their employer, they're more likely to seek out healthcare because they don't perceive the true cost, which means there's more demand, which drives up the amount of healthcare being consumed.
Right. And Mr. Fetterman, could you continue on, but now could you speak on Biden's plan?
Okay. All right. The vice president is opposed to Medicare for all, but he wants to create a public option. We are the only first world country that doesn't provide healthcare for everyone. Right now in this country, approximately 15% of the people don't have healthcare. Because of COVID, several million more have been added to that over the last few months. We want to have a plan that everyone can get coverage, that it doesn't have to be tied to your job. He wants to lower Medicare eligibility to the age of 60, create that public option, and spend approximately, again, we're talking about 30 or 40 million Americans out of 325 million who don't currently have insurance. Wants to spend an estimated $750 billion over a decade. So we're talking $75 billion a year, 75 to 100 billion a year, money provided by his increase in taxes that will provide health coverage for almost everyone. There are huge benefits to having health care coverage. By having preventative care, you can save a lot of money in terms of long-term care down the road. People are healthier when you get preventive care. There are a few days off missed from working. And in addition, and this is critical, part of his plan is to protect people with pre-existing conditions, diabetes, miscellaneous other things, so that when you go from job to job, you can still get covered because you have access to health care. If you're under some kind of public option, you're going to be covered for those as well. That's it. But in a nutshell, wants to make sure that people are protected with medical coverage, which pays benefits by having a healthier population.
And Dr. Axelrod, in contrast, how does Trump feel about this?
Okay. Before I say this, I want to remind our audience again that at Feliciano on our social media we have Business Edge podcasts and Feliciano Live on all of these topics, and you get to spend a lot more time in detail of these. So just as a reminder for people if you are hungry for a little bit more.
A shameless plug, if you will.
Well, all plugs are shameless. So President Trump's perspective, he would like to see some spending cuts on Medicare and Medicaid. And thank you to Todd for those infographics in the beginning, because it's a reminder that with Medicare and Medicaid, we're spending over $1 trillion a year. President Trump does not see that as sustainable. Okay, that's a lot of money to be spending. So what's the take there? Okay, it's going to need to be trimmed back, at least somewhat. And his take is that people need to take on more responsibility for their own health care, right? They may need to work longer, right, to be able to afford insurance coverage, again, from companies that provide insurance coverage. Or they may need to make better investments to afford private insurance, okay? Now, one of the things that he likes to see is improved negotiated prices for prescription drugs. And so that will help lower costs as well. And of course, art of the deal, he's very big on being a better negotiator. So he sees a room for improvement there on the negotiation stance.
Louis, I got to just jump in here. Over the last week, I saw President Trump several times. When asked, because a court case is coming up sometime in early November about the Affordable Care Act being challenged, and it's going to be in front of the Supreme Court. And he already got rid of parts of the Affordable Care Act, and trying to get rid of the whole thing. And when asked, says, I'm going to replace it with a plan that's better, provides better coverage, and it'll be cheaper. And that's it. You never hear what the plan is, because there is no plan that's cheaper. You can't have more, you can't provide more and have it cost less, right? It was extremely difficult to put together Obamacare in the first place, the Affordable Care Act, and he constantly keeps harping, we're going to replace it with something better that costs less. It's one thing to say it, but for 2 years, the first 2 years he was president, there was a Republican Senate, Republican House, and he was in the White House, and no plan came up. So it's very questionable at best. I understand that he wants to cut massive expenses. That's clearly what his position is.
So you're saying he's all talk, no game in that situation?
Specifically on several things, but specifically when it comes to replacing the Affordable Care Act, 100%.
All right. Thank you very much.